everyone. I'm Dr. Manon Fielding, and today we're going to be talking about navigating the jungle of HRT in menopause and beyond. Really, we're just from perimenopause all the way forward because it really is a jungle out there. And I want everyone who sees this to understand that they do have options, and whatever you choose, I think it's most important to be educated and understand what those options are, what the positives and negatives are of anything that you do. Because the more we know and understand that, the healthier we will be, the more well we will be, because we're incorporating things that are going to be good for us, not just what I call outsourcing our health, which is letting a doctor or some other source control and tell us what's good for us, rather than us making that decision and knowing that this is what we want to do. So the more you know, the healthier you will be, the longer you will live, and we're happier and healthier. So we're going to talk today about diet, supplements, exercise, lifestyle changes that really work in this period of time when you're having these symptoms and you don't know what to do. Are they as effective as HRT? And when would you use HRT? When would you want to choose something else? And how long should you stay on HRT? So these are all questions that we're going to answer today. And at the end, I will share with you some of the questions that came up when I did the presentation so that you get the benefit of what other women were thinking. I've been practicing for about 30 years now, and this is a culmination of really my life's work. I'm semi-retired, but I see myself as an educator and a coach in helping women navigate through this jungle. All right, so let's get started. Some of the things that started getting me thinking about what I needed to do in terms of educating my patients is because I saw so many women that fell through the cracks, right? Including myself. So I'm one of those. And the reason for that is that there is incomplete evaluation. So often you will get tested for your estrogen and progesterone levels, but they're not looking at the full spectrum of hormones, and they're not looking at a full day. So for instance, your thyroid hormones can play a major role during menopause. And if you don't look at that at the same time, then you don't really know what's going on with that person. The other one is cortisol. Cortisol is very involved in our stress and our adrenal function. And often when cortisol is high, estrogen is low, and vice versa. Until you've been under chronic stress, then all the levels may go down. So you need to know more about that cortisol level over that 24-hour period to know how your adrenals are functioning. And we're going to get to that in just a minute. So also, HRT is only available in certain dosages, right? It's a medication, and all medications have that issue because it may be too much or too little for your specific body. So it's not as personalized as it could be, as it is when our own bodies create the hormones, right? Hormone fluctuation. So I did talk about that the blood test is only measuring one period of time so that you're not seeing those fluctuations. And especially true in perimenopause when you can go up and down and up and down. So this is one reason why I do other kinds of testing. Okay, route of administration. So oral versus transdermal. Oral tends to carry with it a little bit more side effects than the transdermal. So the transdermal bypasses some of the negative parts of HRT, and I definitely do prefer that use for that reason. The only thing I see as an issue, which I'm not going to get into too much detail today, but when they do transdermal progesterone, it's normally progestin, which is a synthetic progesterone, and there is an increase in cancer from progestin. So that is in the literature, and that is something that it does have an extra risk. You also run the risk of estrogen dominance because, like I said, if you're only measuring one point in time and that woman happens to have low estrogen at that time, you give a certain dose, you may end up with too much estrogen. And also, if it's not monitored properly over a period of time, your body changes and you run the risk of estrogen dominance. And that can actually lead to things like weight gain, breast tenderness, mood swings, and other symptoms. And a lot of times you're not really aware of what's happening because you trusted the doctor to give you the right dose and you're ending up with too much estrogen. So in my practice, what I had seen that started me thinking about a lot of these questions about HRT is I had an 85-year-old patient who was still on the same dose of Premarin that when she started, and she still had osteoporosis. And so both of those things are problematic. What is the reason for developing osteoporosis when you're supposed that, that HRT is supposed to prevent that? And she was taking calcium. Well, she didn't have enough vitamin D. She didn't have some of these other minerals. She wasn't eating enough protein. She wasn't doing any weight-bearing exercise. So it could, I'm not saying it didn't slow it down, but you need to look at the whole body, the whole person, to prevent some of these conditions that are very prevalent in women as we get older. Okay, another example is weight gain. So estrogen dominance is one of the things that can happen when your estrogen is too high compared to your progesterone. And this was something that I dealt with, that I had high estrogen, and I also got really severe migraine headaches. And I believe that that is common with that high estrogen. If you have a lot of stress and you don't have enough progesterone, because when I started using progesterone, a lot of these issues definitely improved. Thyroid hormone can also be an issue. So low progesterone can lock up your thyroid, and you may also be deficient in certain vitamins and minerals that are necessary for thyroid functioning. And these are reasons why we need to do a little bit more evaluation before we prescribe HRT. So the important thing is caring for the whole person. And that's why I love holistic. And it's a combination of science, advanced testing procedures and techniques, and using our lifestyle, which is imperative as well. You can take all the supplements that you want. You're not going to get the same benefit as if you're combining that with a healthy lifestyle. All right. But what is your stress level on a scale of 1 to 10? The higher your stress is, the more likely you are that you have this hormonal imbalance, and that changing lifestyle becomes even more imperative. So that's why I asked this question. So rate yourself, and then we'll talk more about that. All right. The reason that stress level is so important is because of the connection with the adrenals during perimenopause to menopause. Your adrenal gland is supposed to be your backup source. But if your adrenal is really caught up in your stress level, then it may produce the hormones properly. And definitely I had that issue. And I think many of the women that I meet are prone to this. So your estrogen, progesterone, and DHEA are all very important to be produced by your adrenal gland when your ovaries start shutting down. And if they're healthy, then the transition is smooth. And how do you know it's smooth? You don't have a lot of symptoms. If they're exhausted, you have an intensification of symptoms like fatigue, anxiety, insomnia, weight gain, all of those kind of things. Then you know that it could be your adrenal, and you have to address that as part of your program. So if you're on HRT for acute symptoms, you want to still support your adrenal glands so that you can kind of transition off of HRT eventually and let your body take over. So one of the supplements that we use that help on all these fronts is, and maca, I love it because it's supportive of the entire body. And they learned this from Peruvian women, And that's where a lot of the maca comes from. And I recommend that you do get Peruvian maca, that it's organic. And it supports your entire hormone system, your adrenal glands, and your energy level. I find it very energizing. I usually take my maca early in the day because of that, so it doesn't affect sleep. It helps with all of these menopause symptoms, reduces hot flashes, improves night sweats, libido, sexual health, even vaginal dryness are improved. It helps support your mood and helps lower incidence of depression and anxiety. It helps with heart, bone, and mental health. So that's really important. And one of the ways that it helps with heart health is that it's improving your cholesterol balance, your triglyceride levels, and helping them stay within normal ranges. Another option that you could use alone or together with maca is ashwagandha. And this one I have found really is amazing for a lot of the emotional effects of menopause, such as depression and anxiety. It really does help a lot with those things, but it also does much more. And the reason I think it helps with the emotional is that it lowers your cortisol, your stress hormone, which not only affects you emotionally, but it helps with reducing belly fat. And that's a big deal during menopause and bone loss. So, there's so many contributors to bone loss, like we went over earlier. So ashwagandha is one of those things in your toolbox that can help with that. It helps with weight management, anxiety, poor sleep, and bone loss. So this is a very important one, and I love ashwagandha myself. If you haven't tried it, I strongly recommend giving it a try. And it helps increase testosterone, which helps with libido. So I often will recommend a combination of maca and ashwagandha together that help with sleep and libido, which are two of the major components of it. Doesn't help as much with hot flashes, so that's why they work together. They each have their own benefits, and I have found that these work really well together. So the bottom line is you can take HRT, and I recommend if your symptoms are really severe and you want quick results, you can use HRT for a period of time, but also use these other options, the herbs and the lifestyle changes, to make bigger impact on your whole well-being and give you an ability to transition off of it. So the bottom line is you can do a combination with eating a whole balanced whole diet, staying active with aerobic and strength training, getting enough sleep, 7 to 9 hours of good sleep. And I do have another video on that if you're interested and you're having troubles with that, and managing your stress levels. So supporting the hormones with proper nutrition and herbs like maca and ashwagandha really make a huge difference in your well-being. So how does lifestyle versus HRT, what does the research actually show? So exercising 3 times a week actually lowers breast cancer risk by 30 to 40%. That's huge. And if you're not doing that, I highly recommend you get started. Start small, 20 minutes, increase to 40, and that will make a big difference. 3 to 5 times a week. 5 times a week lowers it even more. Vitamin D is a major improvement in breast cancer risk. So you need to get your levels up to about 60 nanograms per milliliter, but anything in the range between 30 and 100 definitely helps reduce that risk and reduces immune system problems, bone loss, many other things. But you want to get it closer to the 60 to 100 is where you're going to get the maximum benefit there. And it actually has to be tested. Vitamin D can be tested on a blood spot test from home. And if you need more information about that, please let me know. Okay, whole food diet and weight loss, lower cholesterol, improve your heart disease risk more than HRT. So don't let commercials or doctors tell you that HRT is going to reduce your risk on all of these different things, when you can also use lifestyle and actually have a better result. Weight-bearing exercise and nutrients increase long-term bone density better than just calcium and HRT. Remember the example I showed earlier where osteoporosis is very common in women that take HRT and calcium, and now they have all these bone building medications and they have severe side effects. And unless you already have severe osteoporosis, you can turn around your bone density with natural means. You don't need to be on those medications. The maca came from Peru. This came from Japanese women. Japanese women have very few hot flashes. They don't suffer from a lot of the same menopause symptoms that American women do, and even European women, because their diet is high in soy. And the soy provides what's called isoflavones. And isoflavones are gentle estrogen modulators, and they have found a very significant improvement in these things in Japanese women who live the traditional Japanese lifestyle, meaning that they have high vegetables, fermented foods like miso as an example, tempeh, and increased fiber. Fiber is also one of those things that I think worldwide has gone down because of the increase in bakery goods are very low in fiber. White bread have all been stripped of fiber. So eating fiber definitely reduces your risk. And how does that happen? So what they found with the Japanese women is that they had the most significant benefit when they had this combination, because it improved their gut health, and there were certain probiotics in their gut that actually magnified the effect of these soy isoflavones. So that's why when you take soy isoflavones, you get an effect from it pretty quickly, but it's not going to be the same as if you have this gut health. And that is something you can improve, but that does take a little time. So the soy isoflavones, they recommend taking 50 to 100 milligrams a day, and it can cut your hot flashes by up to 50%. And that's without this gut connection. If you increase the gut connection, it's even better than that. And it is safe for women that have had a history of cancer, either in their family or themselves. And so you don't need to be afraid to increase your soy. And these are some examples here. You have tofu, half a cup, tempeh, miso, just a tablespoon can increase that, like making a miso soup before your meal. Edamame is delicious. I love that as a good appetizer. Soy milk, which you can use as your morning milk. You can put it in coffee, you can put it in your cereal, and those are not hard to do. And roasted soy nuts. So you can incorporate that with your nuts. So like I was saying, aim for 50 to 100 milligrams, and you want to start low. If your body's not used to it, it may take a little time to be able to digest it properly. And the one thing that I wanted to point out is do not use soy protein isolate. It's not healthy for you. It actually doesn't have the same benefit, and it's harder to digest. And this is something that you find a lot in soy protein drinks. That is, so you want to avoid that. Comparing HRT and natural approaches. So hot flashes, HRT, you get a rapid relief. It's great for acute temporary care, like I mentioned. With natural, you get gradual lasting results. With soy, maca, ashwagandha, those are the examples I've given. There are others. Bone health, HRT does help in the short term. It does help to an extent, but in order to have long-term strength, you need to improve that nutrition, like the full range of minerals and the vitamin, like we said, the vitamin D and the other nutrients, and exercise, especially weight-bearing exercise for bone health. Heart health, HRT improves your lipid balance, but it does increase your clot risk. The natural has the same benefit, and it is improved safety. Cognitively, meaning your mental function, learning, brain fog, those kind of things. The early use may help. Natural exercise, omega-3 fatty acids, and there are other supplements that actually help. That supports brain health just as well, and probably better. Cancer risk, HRT, there's a slight increase, especially with progestin and synthetic forms. Natural is protective and also has anti-inflammatory effects. So there's just so many benefits to using a natural approach. What if you've had cancer and want to avoid HRT? So I'm giving you these options. Some women want to do it as a choice. For me, it was a choice because I already knew that a lot of times that I've tried to use medications, I've had side effects, I don't feel good, and swapping one problem for another. And what I've seen with a lot of older people that are on medications is that over a period of time, they have to take another medication for the side effects of this one, and then another one, and they end up with a whole list of medications, and they never really resolve the original issue, which is nutrient deficiency and hormonal imbalance and lifestyle changes. So start with that, and then you can always add something that you need. All right, so you have your phytoestrogen. You also can support liver detox. So a lot of times with estrogen, you're either excreting it too quickly or you're producing the wrong kind, and doing liver detox makes a big difference. And it's really simple to do liver detox with vegetables, the cruciferous vegetables, which includes your Brussels sprouts, all the smelly ones, the Brussels sprouts, the cauliflower. I'm blanking on the other ones. So there are three to five of those. The fiber, increasing fiber increases the detoxification. So these are things that you can do, and exercise also does the same thing. So as you can see, you can feel balanced and improve your well-being without prescriptions. Some women use low-dose bioidentical HRT while they're restoring their adrenal and thyroid. So you want to, that's the hybrid approach. So you can do that, or you can be on HRT and work on these other issues and start some of the supplements and lifestyle, and then slowly transition off of the HRT. The goal isn't replacement, it's restoration, restoring our body's own ability to provide what we need, which includes hormones and many other things, and that improve with brain health as well. So consider that you're not broken, you're just recalibrating. And how do we do that? The most natural way is balancing our entire body, mind, body, and spirit. And in that way, when you balance your hormones naturally, you're going to reverse biological aging at the same time. The more symptoms you have, the faster you're aging, because it's causing damage. Damage is what causes symptoms. It's not just damage in your joints where you have joint pain, damage internally, you're going to have symptoms. So that is your gauge. How bad are my symptoms? What do I need to do? And start thinking in terms of this balancing. So true healing happens when you support this whole system and not just one or two hormones. So what I recommend that you connect with us on the Holistic Midlife Community, and you could join school. It's called Conscious Aging School. It's not for old people. It's for all of us that want to be conscious of what we're putting in our body, how we're using our body, mind, and spirit to improve our health and well-being so we can balance hormones, energy, and mood naturally. In this school, I have just started this community, so it is brand new. We have 12 courses that we use with coaching. You can do the group coaching or into one-on-one coaching. And also in school, we have free classes and the community. And that's really another important thing, is being connected with other women that are experiencing similar issues. It does help you in your mental state to know that you're not alone. So we have a 12-week solution at one-on-one coaching, and includes the comprehensive pre and post test consultation. So really, we're able to determine a lot of what is going on by doing this consultation, and then we confirm it with in-home laboratory hormone and metabolic tests. We create a complete diet, exercise, lifestyle plan. And then because it takes time, support to make these changes in our life, we do weekly coaching that helps support you and help you promote this healthy lifestyle. Over that 12-week period, you'll find that you're going to make a major transformation in your life. And I can't stress that enough, that having that coaching makes a big difference. So 12 weeks, one-on-one life and health coaching, and midlife anti-aging multimedia course that's included on school. So if you let me know what I offered everyone who took the class, you get $500 off when you message me privately within 24 hours of getting this information. And I want to know more about your experience and how you're doing things. If you don't know what is going to work for you and you want to just work one-on-one and see how that goes, we have a 4-day one-on-one coaching we call our Eternal Youth Challenge, and that's only $47. That way I can actually see what's going on with you. We can determine if this program would be beneficial. And I think it's a great way to kind of get started. All right, so that is the presentation. And a couple of questions that were asked were, what did women do before HRT? Like what did they do? And a lot of them actually live with it. I mean, back in the late 1800s into all the way through the 1900s, women had lobotomies when they were really bad. And I think that's when they really had severe hormonal imbalance. They just got very depressed. They had all these mood swings, and they were put on laudanum, opiates, and they were given lobotomies. And those are two ways that the psychiatric, mostly men, I don't think there were women that did that, treated women in those conditions. So that's what they did before. Now, in other countries, like I explained to you, in Japan and in Peru, they had a natural system built in, because maca, they drink maca, and they had maca throughout their life. So they didn't experience the same kind of symptoms that we do. And in Japan, same thing. They incorporated soy as part of their lifestyle. And I think when we got away from that healthy lifestyle, and in the industrial age, and we started increasing stress, and we started having really having a negative effect on our diet, not doing as much exercise and movement, that's when things started to decay in the American culture, and European is pretty close as well. So that was one of the questions. And if you have any other questions and you get this email with this and you want to ask a question, please feel free to do that. Join school. You can definitely ask these questions in there. And I look forward to meeting you and talking to you soon. All right. Have a great day.